Hi, I'm Amy. I have a daughter, Maddy, who has Rett syndrome, and this is our story with DAYBUE. We've been in Colorado for the past decade and have made this our forever home. There are 5 people in our family: myself, my husband Matt, Maddy, who's now 20, Anna is 18, and then we have Luke, our caboose. He's 10. We're a military family, so we're always together. We love to go to the movies and out to dinner. We're all big sports fans, and we really enjoy going to games and watching them on the television. Throughout Maddy's Rett journey, we've tried different therapies to help with her Rett symptoms. Today, Maddy does physical, occupational, speech, massage, and music therapy. We've always been excited about science and wanted to do our part for the Rett syndrome community. So Maddy joined the original clinical trial for DAYBUE in 2016. We were interested in joining the trial because we were hopeful. We talked to Maddy's doctor, and he thought she might benefit from it. And because Maddy was 13 at the time, she was able to be part of the decision. Since it was a clinical trial, there are a lot of unknowns. Our doctor spoke with us about potential side effects like diarrhea and vomiting. We talked with Maddy and told her the treatment may not make her feel good and it might not work, but she wanted to give it a try. Maddy has been on DAYBUE for over 3 years. Now DAYBUE is FDA approved, and all these girls who participated in the clinical trial made it happen, and that's so cool. Since she's been on DAYBUE, Maddy's had a decrease in the severity of several of her symptoms. Before DAYBUE, she would hold her breath quite often during the day. We called them blue spells because she turned blue and it was terrifying. Now her breath holding has improved and she has far fewer blue spells. Maddy would often wake up in the middle of the night with laughing spells or night terrors. One of us would have to stay up with her. She doesn't do that as much anymore. Before DAYBUE, I wish you could have seen what she was like with her eye gaze device. You would bring it out, she'll close her eyes, she'll turn her head to the side, or pretend to be asleep. Now when you bring it out, she tells me that I'm boring. Maddy realized that her communication device is her voice, and her participation has skyrocketed. She even asks for people's numbers and if we've seen any cute boys. She's now using her eyes more to make choices. Before DAYBUE, if you held up 2 t-shirts, she wouldn't give you a choice, or it would take her a very long response time. Now, she can make her choice much quicker and with her eyes. Maddy used to be super aggressive with her hand movements and it left sores. She had to wear gloves all the time. Now with DAYBUE, she does still wring her hands, but it's not as bad. The gloves are off and her hands can be pulled apart much easier. Sometimes her hands will be still in her lap when she's relaxed and listening to music. Maddy's even grabbed a few things on her own. She grabbed a French fry off my husband's plate at a restaurant, a strawberry, and she even grabbed a cookie once and put it in her mouth. Usually it's food. Another change for Maddy is she doesn't stick her tongue out as much anymore, and she's grinding her teeth less. Overall, she looks calmer and more relaxed. Maddy's dream is to be a food critic one day and specialize in desserts. She loves chocolate. She has a G and a J tube and a colostomy bag, so she truly just eats for enjoyment. So if she doesn't feel like eating, she doesn't, but she always seems to have room for dessert. It's really cool when other people get to see her improvements. Her teachers, her paraprofessionals, and her therapists have noticed some changes. We've always seen Maddy and known her potential, but now others are seeing it. It's been amazing. Maddy's medical needs are more complicated than they were when she was little, because she's getting older. But I really like where we're at. Because Maddy feels better, it's increased our confidence in going out and doing things with her. We took her to a basketball game last year and she had a blast. Maddy even was following the players with her eyes. We've been able to do more trips as a family. We're like, we can do this. Our doctor informed us that diarrhea and vomiting are the most common side effects of DAYBUE. He also discussed other potential side effects. Maddy did experience some vomiting in the beginning of the trial, which we reported to her doctor. While DAYBUE didn't take away Rett, the improvements feel huge to us. DAYBUE has been a really important tool in our toolbox to help symptoms of Rett syndrome. We continue treatment because we continue to see a difference in Maddy. Maddy tells us she's feeling better. Her experience on DAYBUE has been consistent over time. Her improvements in breathing and eye gaze allow her to interact with us and the people around her more. Each child is different and every family is different. So I would just say take your time, consider it with your doctor and your family. But DAYBUE is hope for us. And because Maddy is so hopeful, she wants to stay on treatment. As her family, we continue to follow her lead and maintain that hopefulness too.
What are the possible side effects of DAYBUE? Diarrhea. Diarrhea is a common side effect of DAYBUE that can sometimes be severe. Diarrhea may cause you to lose too much water from your body, dehydration. Before starting treatment with DAYBUE, stop taking laxatives. Tell your healthcare provider if you have diarrhea while taking DAYBUE. Your healthcare provider may ask you to increase the amount you drink or take antidiarrheal medicine as needed. Vomiting. Vomiting is a common side effect of DAYBUE. Sometimes vomit can get into your lungs, aspiration, which could cause an infection, aspiration pneumonia. Tell your healthcare provider if you have severe vomiting or if vomiting happens often. Weight loss. DAYBUE can cause weight loss. Tell your healthcare provider if you notice you are losing weight at any time during treatment with DAYBUE. The most common side effects of DAYBUE were diarrhea and vomiting. Other side effects include fever, seizure, anxiety, decreased appetite, tiredness, and the common cold. These are not all the possible side effects of DAYBUE. Tell your healthcare provider if you have any side effects that bother you or do not go away. What should I tell my healthcare provider before taking DAYBUE? Before taking DAYBUE, tell your healthcare provider about all of your medical conditions, including if you have kidney problems, are pregnant or plan to become pregnant. It is not known if DAYBUE will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if DAYBUE passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while taking DAYBUE. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking DAYBUE with certain medicines may affect how the other medicines work and can cause serious side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also call Acadia Pharmaceuticals Inc. at 1-844-4ACADIA, 1-844-422-2342. What is DAYBUE? DAYBUE is a prescription medicine used to treat Rett syndrome in adults and children 2 years of age and older. It is not known if DAYBUE is safe and effective in children under 2 years of age. DAYBUE is available as an oral solution, 200 milligrams per milliliter. The risk information provided here is not comprehensive. To learn more, talk with your healthcare provider and read the accompanying patient information. Visit daybue.com for the full prescribing information.